If you just found a tick on you or you recently had a bite and you're not sure what to do, take a breath. This video will help you understand what matters, what doesn't, and the exact steps to take next. For some people, tick bites lead to a lifelong journey of health problems. For me personally, that meant fainting and heart problems and organ problems, and I ended up in the hospital. It was a really dark time in my life. I don't want that to happen to anyone else. The best thing people can do if they just got bitten by a tick is to go to get medical help. You can often get prophylactic antibiotics that'll wipe everything out right away. Tick bites can be confusing. There's a lot of conflicting information out there, but it does deserve your attention. So you're right to be concerned. But my goal is to give you a clear framework and understanding so that you know when to be concerned and what to do about it. That way you can come out on top and not have to worry about losing years of your life or thousands of dollars like myself and so many other people have been through. So step one, let's assess this tick bite together. The first question is, was the tick attached and for how long? Sometimes people find ticks just crawling on their skin and they weren't actually attached. They didn't actually bite or have a blood meal. But if it did bite you, it's important to know how long it was attached. One of the most important factors is the duration of the attachment. The longer it's been attached, the more likely you've been exposed to tick-borne illness bacteria. Whether it's Lyme disease, co-infections, or a host of other bacteria that live in a tick's saliva, if you've been exposed, it's important to get medical help. But the longer the tick is attached, the higher the potential risk. If you know the tick was attached for only a couple seconds or minutes, then that can influence how concerned you should be. I would still be concerned. After all, it's better safe than sorry. It's also really hard to know how long a tick was attached because they use anesthetic to numb the area that they bite, so we often don't usually know when they bit us. If you found it attached, it could have been a couple minutes, it could have been a couple hours, it could have been more than a day. But if you do have that information, that's important. Write it down. Next, if you know the type of tick, write that down as well. Not all ticks transmit Lyme disease in the strict sense, but a lot of them transmit other infections. Identifying the tick can give us context and know what to do next, but it's not always possible. And I realize that. Sometimes you just can't tell. Sometimes they're just in the nymph stage when they're very, very small. And it's very difficult to tell the difference between a nymph stage tick in different types of ticks. It's also hard to tell after you've killed the tick what kind of tick it is. Don't panic if you can't identify what type of tick it is, or if you don't know how long it's been attached. That's completely normal. No need to panic, no need to be super over concerned. We're gonna help you through this. The reason so many people suffer is they wait too long and the symptoms start to build up, the bacteria start to take hold, and that's when things go south quickly. For me personally, that meant fainting and heart problems and organ problems, and I ended up in the hospital. It was a really dark time in my life. I don't want that to happen to anyone else. Step two is to monitor the bite area over time. So here's what to look for in the first few days of being bitten. First, normal reactions like a small red bump or some slight irritation. That's completely normal. Your skin's just been penetrated by a bug. This should be similar to a mosquito bite. These alone aren't typical cause for concern. So if all you see is a little red bump at the site of the bite, that's fine. That's not a rash, that's nothing. That's just some irritation from your skin being penetrated. It's completely normal. But here's some signs that warrant more attention. If you see a rash anywhere on your body, not just where the tick bit, that expands or looks like a bullseye and it gets bigger over time. It's usually not raised, it's usually flat, but it expands. It's usually not itchy, but it expands. If the rash spreads beyond the size of a quarter, that's important. That's a red flag. That means that you've been exposed to the bacteria. Or a rash that grows over days. And again, it could be on the tick bite itself, near the tick bite, or it could be somewhere completely different. I had 5 red blotches all over my chest and stomach. I was never bit on my chest or stomach ever. What you're looking for is a rash that grows over days, not just brief redness that shows up and then goes away. As a general rule of thumb, expanding or persisting redness deserves more attention. Step 3, pay attention to your whole body symptoms. Here's some early symptoms to be mindful of. Fatigue that doesn't match your normal baseline. So I'm not talking about just tired like I woke up early. I'm talking about like I can't move, like I just want to lay in bed all day type of tiredness. Can we take a nap again type tiredness? Flu-like symptoms without an obvious cause. If you don't have a viral infection that you know of, like the flu or COVID or something, but you're having like, fever, throw up, all that type of stuff, that could be related directly to Lyme disease, especially if it's very close to the time that you got bitten by a tick. Chills, those type of feelings like a flu. That's cause for concern. Achiness, chills, headaches, or general unwellness, just not feeling like yourself, but you don't know why. If you got bitten by a tick recently and then that happens, that's a red flag. Symptoms can appear days, weeks, months, or even years after a tick bite. Don't forget that. It's important to realize what's normal and what's not. Brief stress-related fatigue or a headache can happen to anyone, but ongoing or escalating symptoms following a tick bite are worth paying attention to. Step 4, know when to seek professional input. Here's when it's reasonable to consult a professional. If the tick was attached at all, I would suggest going to the doctor. If you develop a rash that grows or looks distinctive, you should definitely go seek professional help. If you develop persistent symptoms weeks after the bite, you need help. And look, you're not overreacting for seeking clarity. That's completely normal. You should want to know what's going on with your body, and you should want to know whether or not this tick bite is a concern. And here's what a professional can help with. They can help with the evaluation of your symptoms. Sometimes you can get a Lyme diagnosis just by looking at your symptoms if they match Lyme disease, co-infections, or any of those infections that come from ticks, and you had a tick bite. You can get more clarity on that. You can get guidance on appropriate next steps, whether it's using herbal antimicrobials or antibiotics. But just so you know, doctors probably won't tell you to take herbal antimicrobials, even though they work for thousands of people in the Lyme disease community every year. And finally, you can get peace of mind by just knowing what you're dealing with and what you're up against and what the next steps will be. That peace of mind is priceless. Step 5, stay calm but informed. There's no reason to freak out and run around in a circle and jump up in the air and run around like a chicken with your head cut off. Over worrying can create unnecessary fear. But at the same time, under worrying can delay awareness and delay action for you getting better. The longer you delay taking action against Lyme symptoms, the worse the symptoms can be. Sometimes people lose the ability to walk. I don't want that to happen to you. The goal here is calm, informed observation. Look at all the pieces of the puzzle. Make an informed decision that's best for you. There's no reason to be worked up in a frenzy or not caring at all. Let's stay balanced on this and have the right mindset about how to approach this in a healthy way. Most tick bites do not lead to long-term issues. However, they can happen. Knowing what to watch for helps you take action when it matters. So now you're aware, and awareness is power, and calm observation is your best approach. Taking early action can save your life and make things so much easier.